Okay, good evening, everybody. Welcome to tonight's webinar on scope of practice. My name is Cara Moroney. I'm the Director of Professional Conduct, and Ryan Pastana, our Communications Officer, is also with us moderating the session today. So we've got some objectives that we want to accomplish by the end of this webinar, and so you can see them all there. It's to understand what the scope is, how to determine whether something's in scope or out of scope, to know about the controlled acts and delegation, to be aware and to be able to assess your personal sphere of competence, what to do if something is out of scope but within your competence, to understand the responsibilities of dual registrants, and then finally to understand the implications of practicing out of scope. We did the webinar yesterday afternoon, and there were a lot of very specific questions that were a little bit difficult to answer on the spot, and other questions were easily answered, but easily answered meaning that they're already in the guidelines. So therefore, we may not have as much time for questions today. Please type them in, and we might be doing an FAQ or revising the guideline after. But one of the main objectives is there in that second bullet. And that's for you to, at the end of this presentation, have a better sense or better confidence to determine using your own knowledge, skill, and judgment about whether something's in scope and in your personal sphere of competence, and also to use the resources around you. So again, ask the questions. Ryan will moderate them, and if there's good questions to ask and answer, we will try to do so at the end of the session today. So what is the scope, first of all? Well, the statement in the Kinesiology Act is, the practice of kinesiology is the assessment of human movement and performance and its rehabilitation and management to maintain, rehabilitate, or enhance movement and performance. So it's a pretty general statement. It's helpful in some ways, and it's not helpful in others because it is broad. Most of the other scopes of practice for the other professions are very broad in that way as well. But it's good to think of the scope of practice, I think of it for kinesiology as an umbrella. And each of those different colored panels reflects a distinct area within kinesiology, but it all makes up this overarching broad scope. And it's important to note that just because you're using a different term for your practice area doesn't mean it isn't kinesiology. I think because kinesiologists weren't formally regulated as a profession until 3 years ago, there was this kind of fragmentation. But now all those panels of that umbrella have come together as one, and you're practicing in just different and distinct areas. It's important to celebrate and respect that diversity. Many other professions have many different areas and distinctions within them as well, but because they're more established, they're tied to the overarching profession. So I think it's important that KINS work towards this professional identity and unity as well. So while we talk about respecting the scopes of other professions, it's also important that you respect what we can refer to as maybe mini scopes within this profession. So just because it's under the scope of kinesiology and you can legally or technically practice it, it doesn't mean that you should. So people who practice as ergonomists should probably not practice in athletic therapy, and vice versa. Or people who are working in the fitness training industry are likely not qualified to practice in cardiac rehab, and etc. And we'll talk more about this in terms of personal sphere of competence in that portion of the presentation. I'd just like to note, and on the topic of athletic therapist is a trademark title. So kinesiologists who are not certified with CATA, the Canadian Athletic Therapist Association, should not be using this designation. And sorry, just before we move on, it's important when we talk about these distinct areas, but they're all under kinesiology, everyone who is a registered kinesiologist needs to put this designation immediately after their name before any other certifications. So if you are a ergonomist or you are an athletic therapist, you need to put your RKIN first and then those designations. And you can refer to our use of title guideline on our website. So now we'll move in. So the scope, what's in. I've listed some things. This is not necessarily an exhaustive list. And within this list, there may be some limitations. So for example, if you're in the auto insurance area and you're doing treatment plans, you're probably filling out OCF forms. You'll know that you can't sign off on Part 4, but you can sign off on Part 5. All of these areas that you might be practicing in, or many different areas, that includes assessment and treatment plan development. Now, there may be some limitations, such as if you're doing a program of care for WSIB, there's time limits on how many sessions you can take, or the area of the body you can focus on. So the program of care for lower back, obviously you can only be looking at the lower back. Now that kinesiologists are regulated, you are autonomous practitioners. You do not require supervision. So you can do assessment, treatment all yourselves. Obviously you want to collaborate, but you don't require the supervision of a chiropractor or a PT or something like that, unless something requires a diagnosis. But basically you can see a client from intake until discharge. Some people asked yesterday about what types of assessments can be used, such as a PAR-Q. The college doesn't necessarily advocate one assessment over the other. It's, again, something that you need to look at the area you're practicing in. We don't really do clinical standards. That's something more for the professional associations to do, as sometimes the science can change quite quickly. But assessments generally need to be, or they do need to be, evidence-based. If they're widely accepted in your particular practice area and they don't involve any controlled acts and you're using it to assess human movement, then it's okay. And it's that human movement part that's important to keep in mind. If it's related to human movement, then it's likely within the scope of practice. So that is quite broad. But you need to use your knowledge, skill, and judgment to determine this. Also, under these broad categories that are listed here, there are a lot of modalities that are open to KINS to use, such as TENS, IFC, therapeutic ultrasound, shockwave therapy, ART, active release techniques, osteopathic techniques, etc. These aren't so much practice areas, which is why we often refer to them as modalities. And again, if you're using something to rehabilitate or enhance human movement and it's not a controlled act, then you can do it, and you do not require the supervision of another healthcare professional. And you can, make that recommendation to the client on your own. If you think a client needs shockwave therapy, then you can recommend that to them, go through the consent discussion. You don't require the supervision for that. So the scope, what's out of scope? Well, scopes of other professions, except where there is overlap, and of course that's where there is some confusion and there is lots of overlap with various professions. Some profession scopes are clearer and involve more controlled acts, so it's a little bit easier. So obviously a kinesiologist is not going to scale someone's teeth. This is what dental hygienists or dentists do. But the related professions are harder to discern that line. Sometimes that line is the controlled act. So for instance, chiropractors and kinesiologists use very similar modalities, and we actually have lots of dual registrants in chiropractic and kinesiology. But KINS cannot manipulate the spine and they cannot communicate a diagnosis. It's sometimes an employment setting will help to identify the various roles of practitioners, so it's not so much scope, but it will help you to understand what you can and cannot do according to your employer. There are still some clinics that will have chiros or PTs do the initial assessment and devise the original treatment plan, and the kinesiologist implements the treatment plan, and this is fine. And you may also be able to make changes to that treatment plan on your own. So here are some examples. Diet prescription would not be considered in the scope of a kinesiologist. You need to be this. You can do general nutritional counseling, and I've had a lot of questions about that. General meaning, what's the widely accepted science in that community, and we know that it changes all the time. So if you only learn nutrition in school, you don't want to be getting into anything more in depth than the bare minimum of, eat more fruits and vegetables, don't drink 8 cans of Coke a day, etc. But to get into trying to manage a diet with someone with diabetes would be very problematic for a kinesiologist to do that, and better left to a registered dietitian or an advanced, someone who has advanced training in nutrition. Psychological counseling for mental health issues. So we do know that some KINs, and particularly athletic therapists, might be doing some sports psychology around, how to deal with pressure in a game. But that is different than treating someone for anxiety or for depression, which would be psychotherapists or psychologists or psychiatrists. Vision or hearing testing. We have had lots of questions around vision testing. Some kinesiologists do it because they're doing occupational capacity assessments or things of that nature. It's not a controlled act, so technically it's in the public domain. And if you're doing it as part of a job function and you've been trained on how to do it, that is fine, as long as you explain to the client that the vision test is for the purpose of that assessment and is not to replace an eye exam by a qualified optometrist or optician for their overall eye health. And then another example is massage therapy, and we'll talk a little bit more about this in the next slide because I've got a little bit of a diagram. And then obviously the other big delineation, and one that maybe is a little more clear because it's spelled out, is controlled acts. Kinesiologists are not allowed to perform any controlled acts. There are a couple other professions like this as well. You're not the only ones. You can find a list. There's 14 controlled acts listed in the Regulated Health Professions Act, but you can find them in the Scope of Practice guideline on our website. They're all listed there. Some of them are very clear. You'd never do. Again, like scaling teeth is a controlled act. So one of the most common ones that we deal with are communicating a diagnosis, and the college also has a guideline that we adopted from the Occupational Therapists, College of Occupational Therapists, about the interpretation of what this controlled act means. It doesn't mean you can't provide someone with your assessment of a dysfunction in their movement. So maybe someone has an abnormal gait, the way they walk. That's not a disease or disorder such as diabetes or having a slipped disc or having a broken bone, which you need x-rays for. So that is fine. You can do that, and you can assess it, you can provide your impression of it, and you can recommend a treatment for it. Spinal manipulation, which we briefly talked about, that's open to chiropractors mainly, and PTs if they're rostered for it. And a procedure below the dermis. So this is a very large controlled act because it can mean anything from simple, blood, pricking of a needle or taking a needle to prick the skin to do blood testing, or all the way to heart surgery. So we know KINs aren't doing heart surgery, but these other procedures, it's still technically a controlled act, even if it seems relatively routine. I know some people have said before they were regulated, they were doing this. It's not in the public domain, so anyone who is not regulated shouldn't be doing it unless they have received a delegation or directive. In a lot of settings, such as a long-term care setting where they're doing glucose testing on the residents, there's often a medical directive in place from the resident physician or a nurse practitioner, something like that. We've had questions around what to do if you're seeing individual clients. I know that some people who deal with athletes want to do lactate testing, I guess, to test the muscles before and after exercise. And sometimes in this instance, it's difficult to get a directive because you're not dealing with one doctor for an entire population. So you have individual clients with their own doctors. If you can get a delegation from the doctor, that's great if you can communicate with them. The other option is to talk to the client about what the procedure is, that go through that consent discussion, and they can do it themselves because it is fairly routine. But that's probably the the other safest way to do it instead of doing it yourself. And then acupuncture. This specifically became a controlled act in 2013 when acupuncturists under the College of Traditional Chinese Medicine Practitioners became regulated at the same time that KINS became regulated. So only registered acupuncturists can perform acupuncture. There are 6 other professions who can do it, but only within their scope. So that's meaning a chiropractor can use it to stimulate a muscle in the shoulder if there's a shoulder problem, but they can't use it to treat smoking, for smoking cessation, the way an acupuncturist can. Acupuncturists can treat allergies with acupuncture, but a physiotherapist can't. So this was granted by way of a legislative exemption. So these professions cannot delegate acupuncture further, any part of it. So you cannot accept delegation from a chiropractor, a massage therapist, a physiotherapist for any part of the procedure for acupuncture. That includes taking the needles out. The only profession that a kin can accept delegation from, if you're properly trained, is a registered acupuncturist. And if you're looking for more information on delegation and medical directives, the Federation of Health Regulatory Colleges of Ontario, they have a lot of resources on their website, and you can go to that website. It's www.regulatedhealthprofessions.on.ca, and they have some good information on medical directives. So now we'll talk a little bit more about controlled acts. This is a little bit of a relational diagram to show how certain modalities, where you're kind of having some overlap, and how to distinguish when you're in scope, when you're within a controlled act, and when you're out of scope. So we'll use the example of manual release techniques. This is allowed. You can do this. This is, you're doing this to release someone's muscles so that they can move. That is human movement. But providing massage as a basis for treatment is massage therapy, and it's out of scope. And I think everyone knows, when it's different. If a client comes in and you spend 10 or 15 minutes or even 20 minutes doing active release, because you're then going to move on to some exercise prescription, that's very different than when someone goes for a massage, where you lay out on the table, they drape you, they often use aromatherapy. There's a certain mood that a massage therapist will often set. So I think people know the difference between when you're providing manual release and when you're doing a massage. Going further, using acupuncture as a way to stimulate muscles for rehab is a controlled act, so it's not allowed. So even though the intent is to improve human movement, it's a controlled act. So controlled acts are more specific, they're more narrow, and so that's your first question, really, because it's the easier one to answer. Is it a controlled act? If it is, then you can't do it unless you have proper delegation. And it's important to note that there are some acts which we would advise heavily we would never really advise that they could be delegated to a kin, and you can look on our guideline for those. One of them is spinal manipulation. If it's not a controlled act, then is it within scope? So does it have to do with human movement? And if it is, then you can do it. Or you have to ask yourself, is it more properly in the scope of another profession? And if so, you should refer it on to that profession. It may also be that you need to refer to another kinesiologist as well. And the profession needs to celebrate one another and support one another in this. Yesterday, people were asking about things like applying heat and ice, or recommending over-the-counter inflammatory creams, doing ultrasound. All of these are permitted. They're not a controlled act. They have to do with human movement, and they don't solely belong to another profession. So it's important that you go through this analysis and that you use your knowledge, skill, and judgment to try to answer these questions. Ask your colleagues, refer to the guideline, and then if you're still unsure, you can call the college for further guidance. However, lots of times when you are in a really gray area, we can't always say yes or no. It may depend on your personal sphere of competence, which is really something we can't answer for you. So lots of times, it's just about going through these questions and then, remembering some principles too. Some other people have asked about getting clearances from medical doctors to do certain things. So you might want to do exercise with someone, which is in scope, but do you need a medical clearance? If you believe someone is suffering from a disease, a condition, or a disorder that requires a diagnosis before you can safely proceed, then you should refer that, and you might not want to continue with treatment, even though it's in scope, until you get some more information. It's not so much a question about scope as it is about safety and ethics, but other than to say that you can't communicate a diagnosis. So now we will move on to that idea of personal sphere of competence. So because the scope of practice for kinesiology is very broad, it would not be expected nor appropriate that a kin practice in all these diverse practice areas. It would be almost impossible. Every profession, as you move along in your career, you tend to focus on a certain area. Doctors do. We know that they have all kinds of specialties. Lawyers do, because you can't know everything about everything. So often it's not so much about the question, whether it's in scope or out of scope, but whether it's within your own personal sphere of competence. So for this diagram, and because I took it from the web, I couldn't change some of the words, but ability in the middle would be synonymous with capable or competent. And attitude we would replace with judgment, because you'll often, I think you've already heard me say knowledge, skill, and judgment several times. We always refer to that. So when contemplating a certain treatment or service that you're going to provide a client, you have to have all three of these operating. And it has to, and then if it's in scope, then you can do it. So I like this little cartoon where it looks like someone's just had an interview, and then the person who is going to be doing the hiring says, I agree that you do have drive, ambition, and self-confidence, but what we're looking for is competence. So the judgment part, that self-awareness, the why, is very important. Just because you want to do something doesn't mean you should or you can. So it's important to keep this in check. And when you're in doubt about whether you should do something, then that's a pretty good sign right there that you might need some further training, or you might need to ask colleagues and look at other resources. It's part of the reason why doing your yearly self-assessment for QA is important, because it'll help you identify where you have some knowledge gaps and where your learning goals are. And where you identify gaps, that's helping you to outline your sphere of competence. And if you're looking to expand your sphere of competence, it'll help you to identify that. And just because when you have having gaps does not mean you fill those gaps by immediately treating patients. You might need to take some courses or be mentored in a certain area first. So a lot of people asked whether they need specific training to do things such as active release or fascial stretching, etc. And again, this is to I think they're asking these questions to understand whether or not that's the measure of competence. And again, I think this is a judgment call. Generally, I think if it's a complex modality, seeing someone do it a couple times or learning about it 10 years in school is probably not sufficient. So it depends on the modality. You also want to look at industry norms. So if people in the industry who are doing fascial stretching, for instance, have all taken certification course of one sort or another, then that's probably your answer. You maybe shouldn't start doing fascial stretching just because you've been watching one of your other colleagues do it. You might need to take those courses as well to gain that competence. So again, just because you think you can do it and you want to do it doesn't mean you should do it. And you know, for certain certifications, like we know the athletic therapist certification, it's a very well-known and respected one. So it's probably not advisable for non-athletic therapist kins to practice in this area. Just the same way that a kin that's doing doing rehabilitation in a private clinic wouldn't start doing ergonomics. They're pretty different. You also have to think about sphere of competence, not just in subject matter area, but also client population. So you may be working in the fitness training environment, and you're working with generally healthy people. So starting to work with clients with a history of diabetes or heart disease may go over and above what your expertise is because they're more complex. Other kins might be working with elderly clients or clients with physical disabilities. So that's another area of sphere of competence that you have to look into, is subject and client population. So it's difficult for the college to answer some of these questions for members. You know, we don't know what your personal sphere of competence is. We're also not out there in the practice environment. So again, that's why I tell you to look to the industry norms before engaging in a certain practice, if it's something that everyone's taking training for. You need to be guided by these principles that I've tried to outline, and also by principles of accountability, best interest of the clients, ethics, etc. You're always going to be accountable for the care that you provide, whether it's in scope or out of scope. So if you provide a service for someone and then they complain because it hurt them or it did more harm than good, you have to be able to confidently respond to that and say, you know, well, I did this training, I did that training, I've had this many years of experience. And if you can't, then again, that's a pretty good sign that maybe you shouldn't have been doing it in the first place. So competence and scope. So I kind of have you coming back to that umbrella. You know, so you've got the umbrella here. So you should never practice out of competence. You should never be practicing out of your sphere of competence. That's a pretty clear one. Incompetence is subject to discipline. If it's very serious, it results in serious consequences, or it represents gross negligence, or it may result in some type of action by the Increased Complaints and Reports Committee. So it's not allowed. You need to be competent. However, you can perform duties and certain practices that are out of scope, as long as they're not under the scope of another profession, and you're not a dual registrant. But if under the following conditions, so you have the competence to do so, it is necessary and in the best interest of the client to provide that aspect of treatment. There was no one else readily available, or it's part of a job that you're doing. So again, for that example of doing eye testing for a job, an occupational assessment. And finally, that you've explained the treatment or the service option to the client, that you've explained that it's out of scope, and that they consent to proceed. And this is the same if you're going to be going into practicing in another profession. So maybe a profession that's not really regulated, such as nutritional counseling. So if you're going to be getting into that more in-depth nutritional counseling with a client, maybe you are still providing them with kinesiology services, and then you want to offer them those services as well. You have to explain to them the difference, and you should explain to them what additional training you have in order to provide those services. But always know that you're still accountable, because you never really take that kin hat off. So you still have to, practice according to certain conduct standards. And if you are a dual registrant, we'll get to that later, how you merge from one profession into another. So dual registrants. So first of all, to be clear, a dual registrant means being registered with more than one health regulatory college. It doesn't mean being regulated as a kin and then certified with another body that's within the scope of practice for kinesiology. So for example, if you're an ergonomist with ACE, or you're an athletic therapist with CATA, or you're certified by CSEP, those are just to distinguish that you have additional training in a distinct area. You can list those, but they're not a dual registrant, because when you're practicing in those areas, you're practicing under the scope of kinesiology. So if you are a dual registrant, you can refer to the standard that we have on, it's called dual healthcare. So if you're a kinesiologist who's registered with more than one health profession, the issue becomes more about when you stop providing treatment as a kinesiologist and when you start providing treatment under that other profession. You can provide treatment under both of your professional designations. So if you're a massage therapist and a kinesiologist, or a kinesiologist and a chiropractor, you can provide both those services. But you must ensure that, first of all, you are transparent about the services you are providing and when. You make a clear separation with respect to the billing. You ensure the health record reflects what service is being provided. So you can have one health record for one client and just indicate which day, which treatment you provided and why, and you do all your notes that way. Or you could have two health records separate. That's your choice. Just as long as it's clear, you have to remember the principles of record keeping. If someone picks up that record, they can understand what's going on. And then you also must ensure that you're not in a conflict of interest if you are recommending additional services which you also provide. So you have to go through that kind of consent discussion where you tell someone, I think you need a massage because you're really tight. It's hard for me to provide you exercise when before you had the release. I can also provide these services. However, if you have a massage therapist that you'd like to see, you're more than welcome to. There's no pressure. So you have to do that so that you're not in a conflict of interest. And then always remember that you're accountable for your practice and conduct as a kinesiologist anywhere. If you're acting under the scope of chiropractic, and technically a client could complain to both colleges if they felt that your professional boundaries weren't appropriate. We might not be able to investigate a complaint that had to do with the clinical side of chiropractic, but we would be able to look at a complaint that had to do with the manner in which you communicated to a client. So you're always accountable for that care. So finally, the implications when you are kind of in a little bit of that gray area. I think if you're practicing in scope and you're not performing any controlled acts and you know your personal sphere of competence, you're probably going to be okay. But sometimes when you get close to those lines, or you're a dual registrant, or you have a nutritional counseling side of your business, it can begin to feel a bit like a tightrope, because you've got the scope over here, but you've got competencies in another place. So it's not that it's wrong, but you just have to remember the certain implications and remember certain principles. If you are practicing in a different area, make sure that you have insurance coverage for that. So you may not be covered if you weren't practicing kinesiology. Again, if you're practicing in athletic therapy or ergonomics, and that's what you call it, but you have insurance as a kinesiologist, it will cover it if it's under scope. You risk a complaint or investigation if you practice out of scope and didn't get consent, or if you practice out of your sphere of competence, of course. There's a risk of bringing disrepute to yourself and the profession as a whole if the profession gets a reputation for, pushing the boundaries of other professions, what we call scope creep, or practicing out of your competency. Obviously, that affects the profession as a whole. And then again, and also with those other professions, you risk fractious relationships if kinesiologists aren't respecting the scope of other professions, and vice versa, of course. But it's important that that's where the collaboration comes in. And then, of course, implications of conflict of interest. If you're referring services out of scope for kinesiology, but you also provide them, again, you have to be very careful that you don't find yourself in a conflict of interest, because you know, it's a topic that keeps coming up, and definitely clients don't like to find out about that after the fact. So that's it for the presentation part. We are definitely in time for some questions. I'm just looking up. Some of them are very lengthy, so I don't want to be sitting here reading for a long time. So we'll just kind of go through them quickly and see if there's any that are that I can answer quite succinctly in the time that we have left. So we have a question about nutrition, and this is very common. So in scope for kinesiology is general nutritional counseling, and general meaning you can't start delving into discussing micronutrients or vitamin absorption, or you probably shouldn't be treating or providing nutritional counseling to anyone who has significant nutritional disorders such as diabetes. If someone doesn't have advanced practice, or sorry, advanced training. So if you are undertaking advanced training in nutritional counseling, and you're going to want to be doing things like providing a diet plan, or providing or recommending supplements and different things like that, that gets out of scope. And it's not that you can't do it. If you have additional skills and training, you can provide nutritional counseling, but you have to go through those steps of explaining it to the client and making sure that they understand that, you know, you're acting as both, and there's no conflict of interest. So advanced nutritional counseling, something that goes beyond the general nutritional counseling that you would have learned in your 4-year kin degree, which is the registration requirement for this college, is out of scope. So hopefully that is clear. If you're doing it, if you've had that advanced training, then you may want to look at the standard dual health care on how to set that up if you want to do both kinesiology and nutritional counseling. So we'll just look at a few more questions. So there was a question about, can you perform a controlled act if it's delegated from a medical doctor? Yeah, it depends on what the delegation is. You need to, the person delegating the controlled act has to, first of all, be able to do the controlled act themselves, and they have to be accountable for the delegation, and you have to be accountable for accepting it. So medical doctors don't usually do manipulations of the spine. They're not chiropractors, so they wouldn't really be delegating that. So you can accept delegation from the profession that is responsible for performing those acts, but certainly something like doing the lactate testing or the glucose testing, if there's a directive in place from a medical doctor, that is permitted to do. Might just look at another question here. Okay, there was a question here. Would I be able to administer clinical assessments for Parkinson's disease to know their motor state in a clinic or in a research program? Does it make a difference that these tests are normally done by a neurologist? So that question might apply to other areas where you're dealing with clients that have, very acute progressive diseases. Usually with people who have, really complex care, there's usually a team of healthcare practitioners. So it's always good to check with your team about what assessments you're wanting to do. Again, if the assessment doesn't have controlled acts in it and it has to do with human movement, then again, it is likely okay. So if you are assessing how well someone can still move with Parkinson's disease to try to come up with some exercises to help keep them mobile, then that's likely okay. But again, you have to look at your industry. If neurologists do this mostly, then ask, and talk to the team, talk to the program, and ask if this is something that might be able to be changed. Lots of times systems and hospitals change with who does assessments and who does treatment. So you can sometimes work that out. So it's a good question. I definitely think, because it has to, I think a lot of other people have the same questions when they're dealing with people with brain injuries and whatnot. But I think when you're dealing with those complex clients, it's good to work within that team and devise who's going to do what. Sometimes it's not so much a question of, oh, well, yes, it's in scope, I can do it, and maybe it's within competence, sure, but you have to work with your team members and communicate that. I might just look at a couple more questions and then we'll sign off shortly. Okay, we had a question about the dual registrant, and it is, if you are practicing as a certified podorthist, are you still practicing as an RKIN? And yes, that is correct. So, and it's the same with athletic therapists or ergonomists. So once you register to become an RKIN, if you're practicing under the scope of kinesiology, which has anything to do with human movement, despite the fact that you might have another certification and you call yourself that, you're still under that overarching umbrella. You're just practicing in one kind of panel of that umbrella. So you've chosen to be regulated. The practice you have has to do with human movement. Therefore, you're an RKIN first. You need to put that after your name, and then you can put the other designations, which denote which area of practice you're practicing in, so you can give that information to the public. We have a question here, can we do kinesio taping without specific training? So again, when I said about certain modalities and certain practices, you go through that. Is it a controlled act? Well, no, it isn't. Is it within scope? Does it have to do with human movement? Yes, it does. Whether or not you're competent to do it is a question that you have to ask yourself or ask others around you. If it's a complex modality, you might need to go take a course to learn how to use it. But if it's simple, then you may not. You have to look at what are other people doing, or is it something that, the senior kinesiologist in the clinic can show me how to do, and that's fine. We can't answer those types of questions. It's really up for the kinesiologist to do that in tandem with other professions if necessary. So there's a question about working with clients with mental health issues, and can you work with them without specific training, for instance, creating exercise programs for clients with depression or anxiety. I've had this question before. You cannot counsel, you cannot provide psychology or psychotherapy to people with anxiety or depression. We do know that there's lots of science that shows that exercise can help manage these types of diseases. Again, whether or not it's an area that you require specific training in, I don't think there's any science out there that says that certain exercises, like running, helps anxiety more than biking. I don't think it's anything like that. I think it's just overall that exercise does help. You can help provide exercise and help provide motivation to people who are in those categories. But again, remember the personal sphere of competence also applies to client population. So you may want to have some background as to the different challenges that these clients have with doing exercise so that you can help them exercise. But you're not going to be counseling them on the reasons for their anxiety or their depression. I mean, that's up to a qualified psychologist or psychotherapist to do. We'll just take a look at a couple more questions before we sign off. Okay, I think the rest of the questions are fairly involved, so we will, if any, I can try to answer these. You can always send me an email specifically with the question, or let me know that you asked the question at the webinar and I'll look it up and I can answer it specifically. Or as I said, we might do an FAQ or we might revise the guideline. But I'll come back again just to the principles of trying to ask yourself those questions. Looking at what's the norm in your practice environment out there, asking your colleagues, because some of these questions we can't answer for you, yes or no. Some things are easy. Can you do acupuncture? Well, no, unless it's delegated by a acupuncturist. But for these more gray areas, or is it within your competence, that's your judgment call, and you have to be willing to always be accountable for the care that you're providing. So again, just trying to understand the principles. What's in scope has to do with human movement. It's not a controlled act. Okay, great. But also just be aware of other professions outside of kinesiology and other areas within kinesiology, and respecting those various scopes of practice. So thank you very much for attending. You will get emails confirming your attendance so that you can put this towards your QA CPD, because I know that's why a lot of you are here. But we hope that you did find this somewhat helpful. And again, you can always email me or call me with your questions. But do try to do that analysis, and do please read the scope of practice guideline when you do have questions about scope. Some of them might be readily answered in there, and then if you're still having difficulties, then you can give us a call. So have a great night, everybody.